Hi, my name is ABIENVENU, and today we're going to talk about infection control, the importance of hand hygiene, equipment used for infection control, choosing the type of isolation depending on the infectious situation, identifying which patient may be assigned in rooms together. To start, let's talk about the importance of hand hygiene. Though I already done a video on hand hygiene, showing you the steps, but we're going to incorporate this in this video as well. So make sure you use soap and water. Use at least 15 seconds of vigorously scrubbing to kill the bacteria. The thing with that, the scrubbing is going to break down. You want to make sure that you're getting in between the cracks here. Oftentimes we just rub our hands and we think it's enough. You got to make sure it gets in the wrist and make sure that you're going underneath your watch. If there's a watch on, take it off. Underneath your rings or jewelry, making sure you're inside the cracks and whatnot. The reason I say that is because never just use the alcohol deal for C. diff. There is appropriate times to use the hand gel. You can use the hand gel or the alcohol for patients if it's not visibly soiled and if it's not C. diff. You also 15 seconds of vigorous scrubbing. The friction is what breaks up the bacteria that's on your hand, loosens it, and allows the chemical to break it down and to kill the bacteria. Again, make sure that you're scrubbing in between all of the creases and cracks. Okay, so now that is on my hand hygiene, we're going to transition to the equipment used for infection control. We're going to talk about the PPEs. We're going to kind of talk about each different one where you may wear some, you may not wear it in the other situations. What are PPEs? We got a gown, mask, goggles. We have gloves, obviously, and there's certain situations where you use different masks. You may use a face shield or little booties on your feet. Depending on what the situation is when you would use each different one. We'll get into that a little later on. So the next deal is the type of isolations. So what are the different types of isolations? We have the contact precautions, we have a droplet precaution, as well as an airborne precaution. So we'll start with the contact precaution. Contact precaution is spread by physically touching someone else or the environment that's already contaminated. Most times that's staph or MRSA, lice, where you physically put your head and it had lice. It's gonna obviously you're gonna be contaminated. Scabies, C. diff. Back talking with the PPEs, I was gonna say that per each precaution, I'm gonna incorporate that back in. So for the contact precaution, there needs to be gown, gloves, and appropriate hand hygiene, like I said earlier. Making sure that whatever you touch, like if you contaminate your hand and you touch another piece of equipment, obviously the equipment's contaminated as well. So make sure that you don't spread the contamination throughout the hospital to yourself. Just make sure you don't overthink the little things or look past, oh, it's fine, it's not physically on me, I'm good to go. No, just make sure that you cover all of your grounds. The next precaution is going to be a droplet precaution. That one is spread by coughing, sneezing, suctioning, bronchoscopes. That is going to be more of a it's a different. What separates this one from, say, airborne, this one is the droplets in the air. Like it's not. Well, let me see. It's more like I said, coughing, sneezing, and suctioning. Just something physically coming out. Okay, you're mostly going to see this with the flu, meningococcal meningitis. The PPEs that are you need to use for this precaution would be a gown, gloves, mask, and face shield, because you don't want, with the addition is the face shield. You don't want to use, if you have your face near the patient and they cough, well, obviously you just got that or contracted that, and like I said earlier, the infection zone is 3 feet. So if you're anywhere near that area of the patient, you have a potential risk of contracting that if you don't use the proper PPEs. So next, we're going to talk about the airborne precautions. This one is going to be it's going to be, they're all severe, but this one you have to truly make sure that you are covering all of your grounds. You should cover all your grounds on all of them. However, this one, like I said, the other ones was like 3 feet if you're near them, but definitely this here, there's no margin for error. Airborne precaution is spread by the air. It's spread by the air current, so it can literally just move in the air and in the particles in the air. It's also able to be there for longer amounts of time. Now, with airborne, we talk about TB. This involves TB, chickenpox, and as well as the measles. The PPEs required for this should be a mask, a gown, goggles, and gloves. The mask needs to be a specific fitted mask for you when you're talking with TB. It needs to be an N95 mask, and before you go to work in the hospital, make sure that they fit you properly. They're going to put something over you, and it's going to have the mask to seal to your face. They're going to put a big deal over your head, and they're going to pump the little, I guess it's like a dye or a gas inside of this little mask. And if you taste it, obviously it's not sealed correctly. If the mask is too big or too small, make sure that you have the proper fitting mask to prevent yourself from exposing yourself to something that you don't want to get. Let's see. Now, we need to discuss, if I had to decide whether it be a contact precaution, a droplet precaution, or airborne precaution, which patient would I put together? And I would use a contact precaution and a droplet precaution. The reason I would do that is because the contact precaution, you physically have to touch that patient to contract it or to expose yourself to it. So that patient's not necessarily going to harm another one. It would be more of the healthcare professional contaminating the next patient. It wouldn't be necessarily the patient. It's not just going to jump over in bed. C. diff's not going to jump from this bed to the next bed. It's not how that works. And linked with the contact precaution, I said I would use the droplet precaution because there's a 3 feet zone. If those patients are not within 3 feet, then their odds are that they're not going to contract and they're not going to bother each other. You never want to put an airborne precaution in those two, because that airborne room, in theory, the whole room is contaminated. Okay, you got to make sure that you make sure you never put an airborne precaution in these other rooms, no matter what. Also, I want to go back to airborne precaution. Most times you would use a negative pressure room because of this reasoning. The whole room, like I said, is going to be contaminated, and there's going to be special filters to be able to suck or the negative pressure out air so you don't expose the rest of the hospital and potentially contaminate the rest of the staff or the other patients that are in the hospital. Now I'm going to go into a little more in depth, just kind of cover basic nursing responsibilities that I feel are important. We should definitely wipe down all equipment used in these patients' room with contact and droplet. Airborne, that needs to stay in that room assigned to that patient for the time being, and then properly cleaned at a later date. I mean, clean throughout in the room, but don't transport an airborne precaution room equipment into another room, because then you're potentially exposing the patient as well. So make sure you're wiping down all the monitors, the railings, your keyboards, tablets, your little deal you roll around with your computer. It could be really, really dirty because it's literally going in every single room, and your fingers or you have gloves on and you're typing on your keyboard, which is now has everything that patient has is all over your keyboard. Make sure that you wipe those guys down. Make sure that the purple wipes are C. diff or a bleach wipe. Never use it directly on your skin. They say that it can give you cancer. Make sure that you are just thoroughly cleaning everything, as well as another responsibility I'm just going to touch on is educating the family. It's really important when you see the family in and out of the rooms with not properly wearing the PPEs. Though they think, oh, it's just mom or it might be just dad, but right now mom and dad are sick, and then you may be exposing them, or they may be exposing something to you that you don't want to contract or you want to get. So education is really important right there. Again, to reiterate, you want to do daily little responsibilities, wiping your computer screen down, the tabletop in the room, the keyboards on your mouse, your scanners, the door handles, the bed rails, the head of the headboard, anywhere that it's going to touch, the patient's going to touch, the footboard, equipment on the bed, anything that's basically used to treat the patient, IV poles. I think that's probably one of the things that's getting neglected the most. Say the IV pole, it's just in that room, and we think, oh, it's the lines was bad, but if that patient, odds are that IV pole is closer than 3 feet from the patient. It's literally sitting next to them. And the patient may lean over and grab, and oh, we're going to walk down the hall, and then I come and grab the same exact pole. Well, it's contaminated. So things that we don't normally think of, we need to bring to our attention and make sure that we are cleaning those to prevent future hospital-acquired infections to other patients. The next thing with the PPE is the proper way of putting it on and taking it off. You would think, oh yeah, just put all this on. No, there's a certain step because you don't want to expose yourself. You took the precautions to gather everything right. Now that we need to follow the correct steps to put it on. So making sure the steps to put it on would be your gown first, mask, and your goggles, then your gloves. Okay? Making sure that you have to take it off. Obviously, think about the dirtiest thing, your gloves. You want to take that off first. Okay? Then your goggles, because you don't want to contaminate your hands and you here. Take your gloves, goggles, gown, and then your mask. Okay? Because regardless, depending the mask, they're like, oh, I got goggles and mask. But what if you're still exposed to something in that room? Okay, that you don't want to. So after you take all of the PPEs off, wash your hands. Like we talked about earlier, whether it's visibly soiled or C. diff, always wash your hands with C. diff. I think that's pretty much everything for infection control. We talked about assigning the rooms together, the different types of isolation, the equipment used, and the other video physically demonstrates me using hand hygiene. Thank you for watching, and my name is ABIENVENU, and I'll see you in the next video.